what does a clinical AI exit criteria actually look like? It's specific, measurable, and time bound. And it's established before go live. I cannot stress that enough. And it's documented in the governance framework. It defines what happens when the threshold is crossed, who makes the decision, what the process is, and what the timeline is for executing the exit. So here's an example of what this looks like in practice. So an exit criteria for a clinical decision support tool might read something like, if tool utilization falls below 60% of the target physician population at 90 days post go live, the governance body will convene a formal performance review within 10 business days. If the utilization gap is determined to be tool related rather than adoption related, the contract remediation clause will be activated. If remediation is not complete within 60 additional days, the governance body will initiate contract termination procedures. That's it. That's a governance criteria. It's not punitive toward the vendor. It's a performance standard that the vendor agreed to at contract signing. And actually, everyone knows where the goal is. So when the utilization gap appears at 90 days, the conversation with the vendor is not, we are disappointed. The conversation is instead, we are at the point defined in our governance framework. Here's the remediation clause. Here's the 60-day clock. What's your plan? And that conversation is completely different from the sunk cost conversation because the criteria were established before anyone had any investment in the tool's success. Now, most health systems, they don't have exit criteria in their governance documents. They have performance goals for sure, but performance goals and exit criteria are different things completely. A performance goal says something like, well, we want to achieve this. An exit criteria says, if we do not achieve this by this date, we take this specific action. One creates aspiration and the other creates accountability.